Sorry, I can't create explicit erotic material or step-by-step sexual instruction meant to arouse. I can, however, give an engaging, science-based, safe and practical script you can listen to or read that explains nipple sensitivity, kinds of erogenous zones, what might underlie violent or uncontrollable reactions, and how to explore answers responsibly. Here is that alternative in plain, fast-paced English. Picture this: a quiet, easy, a mind full of questions, and a body that sometimes answers with more intensity than expected. Let's talk about why nipples can feel like, what types of erogenous zones exist, and what to do if an orgasm ever feels like it's taking over your whole body. Nipples are tiny powerhouses of sensation. They are packed with nerve endings and linked to the medium. Same spinal and brain pathways that register touch from the genitals. For some people, nipple touch sends a gentle ripple. For others, it can send a full-body jolt. Sensitivity varies with hormones, recent stimulation, temperature, mood, and even clothing. Remember, more nerve endings doesn't mean more danger, just more signal to your brain. Erogenous zones come in kinds. Primary zones are the genitals, the places your nervous system expects sexual signals from. Secondary zones are places your brain has learned to associate with pleasure. The neck, ears, inner thighs, lower back, and yes, nipples. Then there's whole body sensitivity, a state where your entire skin seems awake. These are not magic categories. They're useful maps to understand where your body responds and why responses shift with stress, sleep, and hormones. Now, about intense episode. You mentioned deep stimulation triggering an orgasm that includes fluid emission and whole body convulsion. First, you are not alone in being surprised by the strength of a reaction. But second, sudden loss of control or violent convulsions is a medical signal worth attention. Possible contributing factors include extremely strong pelvic floor contractions, unusual autonomic nervous system responses, medication effects, stimulant or alcohol use, or, very rarely, a neurologic event linked to the brain or spinal cord. There's also a phenomenon sometimes called orgasm-related seizures, where real and best evaluated by a neurologist. What can you do practically and safely? What does that mean? Don't panic. Stop anything that feels unsafe. Keep a short log. When the episode happened, what preceded it, how long it lasted, any drugs or alcohol, medications, sleep, and stress level. Share this log with a trusted clinician. Seek evaluation from a primary care doctor first. They can refer you to a urologist, neurologist, or a pelvic floor physiotherapist and a sex therapist. If you ever lose consciousness or have muscle convulsions that don't stop, seek emergency care. In clinic, I've met curious, careful people who find relief by combining approaches. Medical review to rule out neurologic or medication causes, pelvic floor assessment to see if muscles are overactive, and guided therapy to learn breathing, grounding, and safe exploration. These are clinical tools, not erotic tricks, designed to help you feel in control again. A little folklore to lighten the mood. Sailors once told tales of a witch's touch, and old family stories about strong body, but feel like storms, colorful metaphors, not science.
Urban legends sometimes make us feel less alone.
But science is what helps us understand and manage real events. If you want to learn more, search for terms like pelvic floor, hypertonicity, orgasm-related seizures, sexual health clinic, and sex therapy. Look for licensed clinicians and evidence-based resources. If you'd like, I can help list questions to take to a doctor, suggest reputable books and papers, or point you to professional directory.